My name is Dr. Heather Moore, owner of Total Performance Physical Therapy. Tonight we're going to talk about what happens when you go to the gym and your shoulder starts to hurt. I hear about this a lot, especially in the gyms that I go to. I try to avoid dishing out information and just dishing out advice when I'm at the gym because it's my time, but a lot of times, especially in yoga classes, I'll hear, man, my shoulder is just killing me, or I can't lift overhead, or, and a lot of times that'll happen, especially January timeframe, February timeframe, where people will just get into new exercise routines, they'll change up their exercise routines, they'll start exercising. So there's some things that you want to be careful and look out for, and some things you can do if you start to feel that uncomfortableness or that pain. First of all, you don't want to stop using it, and I hear that all the time, and it's really hard for me not to interject, but at the same time, I only have a limited time to be at the gym, so I can't be there treating everybody. But this is the number one thing that I hear is people say, oh, you know what, I'm just going to stop doing, X, Y, or Z. My shoulder started to hurt, or the instructor will say, hey, why aren't you doing this? Oh, my shoulder hurts. So one of the things is you never really want to stop doing things with your shoulder. If you're to the point where you can't literally use it anymore, you need to be seeking treatment immediately. That's not okay. What you want to do is if you have started some pain in your shoulder, it could be from a number of things. One, it could be from overuse, and which is most likely what's happening, and you could be developing a tendonitis. Now, the earlier you catch it, the earlier you do something about it, the easier it is to get rid of. But a lot of times when you're doing things overhead, you're lifting overhead, you're working out, you're doing some new things, you're going to use poor body mechanics. And a lot of the popular workouts today, HIIT classes, your high intensity classes, your boxing classes, really require a lot of fast movement, a lot of quick movement, not a lot of time to stare in the mirror and watch yourself do those movements. So what happens is you'll do a 30-second bout maybe in a HIIT class or a boxing class or CrossFit or whatever, and by the time those 30 seconds are done, you are exhausted, and you got exhausted at 15 seconds. Well, what happens at 15 seconds when your muscle becomes fatigued? Well, you're going to start to use accessory muscles, like your trap, like your muscles in your neck. They are very, very, very susceptible to being overused because as your shoulder muscles fire, your technique gets bad. So it's going to happen without you even knowing it because you're just going to tell your body to just keep punching that bag, just keep doing that movement. Whatever it is, you're just going to tell your body, don't stop. Well, your body's not going to stop, and if it does, then there was a major problem. It's probably because you tore something, but it's not going to stop. So you're just going to wind up doing a compensation. Like for me, I know that if I do an upright row and I don't look in the mirror, I'm going to do this. Like without a doubt, I'm going to do this. Okay, and then I can turn my arm and I can fake it till I make it because sometimes my shoulder will hurt, especially after a long day of treating. Well, most people aren't going to notice that, and I see it all the time. People are doing upright rows like this, and they're doing upright rows like this, So you have to be careful because the subtle changes you make every day with your workout are going to affect your shoulder pain. The best thing you can do if you have shoulder pain is to continue to do the movements, maybe do them slower or do them without weight. So if you're having problems moving your arm overhead, stand in front of a mirror and watch yourself do a couple of unweighted reps. If that is bothering you and it really hurts, a lot of times what you can do is you can go below this plane. And what I mean is planks. And I know everybody hates planks, but any of that motion where your shoulder stays still is phenomenal for shoulder pain. And I know it's counterintuitive and everybody wants to not do anything, but planks, side planks, reverse planks, if you are experiencing shoulder pain, especially overhead, doing those planks, doing those movements where you just hold it still and you actually allow the muscles around the shoulder to respond appropriately, really hard to cheat with planks, really hard to use accessory muscles when you're doing a plank, which is why everybody hates them because they make you work. Now you can sag your body or you can make your stomach come down, but it's really hard to cheat when you're doing planks. So if you do a plank and you hold it for a minute 3 times, that's going to be a great shoulder workout, it's going to be a great ab workout, and it's what you should be doing. And if a fast movement or a movement during a high intensity class is bothering your shoulder, just drop down and do planks, okay? That's going to be enough for a shoulder workout. If you need to mix it up, you can do shoulder touches. So you're in plank position and you can do shoulder touches. Again, you're not moving, you're not really doing anything, you're just bending your elbow and touching the other side. So a couple of variations you can do if you're winding up with your shoulder hurting. If your shoulder continues to hurt and you ignore that kind of initial pain and you're like, oh, okay, it's nothing, Or let's say it goes away the next day, and you don't really do anything about it. It's going to get worse. You're going to wind up actually impinging that muscle, and we call that impingement because you're pinching this muscle in between these bones. So when that really starts to happen, you are going to have pain every time you lift overhead, without a doubt. And you're going to have pain basically once you lift beyond 90 degrees. If you do any motion called internal rotation like this, that's going to bother you. So you're going to be a little bit more impaired now. A lot of times impingement is not going to go away on its own. You're going to actually need to seek treatment for that, but you're going to feel more of a pinch when you go up on top there. And if you ignore it for longer, you're going to tear that rotator cuff. So that dreaded rotator cuff tear can come with overuse at the gym, can eventually come from not doing things properly. As you have that impingement and you're pinching that muscle, it actually will start to tear. You know, if you pinch it enough, it's going to start to tear. It's not just going to pinch, it's going to tear, and then you have that issue going forward. So you're going to deal with a rotator cuff tear, and then that can either require physical therapy or surgery, most often physical therapy now what the reports are finding. So if you find that you're having this shoulder pain and you're going to the gym, number one, you want to watch all your movements. If you are doing high intensity, high rep, any sort of weight, watch your form. Have somebody else watch your form. Your body will let you do the movement. May not let you do it correctly, but it'll let you do the movement. So you need to watch how your form is. 2, if you find that you have shoulder pain, don't stop using your shoulder. That is the number one mistake most people make. They stop using their shoulder for 2 weeks, and then they come back and they use your shoulder again, and it might be good for another 2 or 3 weeks, and then all of a sudden it hurts way worse because they didn't correct the problem. All they did was rest it. So rest is not the answer in this type of situation. What you want to do is, if it does hurt to do any fast motions, you're going to go to planks, you're going to go to side planks, you're going to go to reverse planks. Those type of activities where you just hold your shoulder still, you just hold your arm still, you don't move, those are going to be really, really good for you, okay? And third is, if you continue to push through the pain or you ignore the pain, it's going to become tendonitis, which will then become impingement, and then possibly, or more likely, a rotator cuff tear. So shoulder pain is not something that you want to pay attention to. It doesn't mean that you stop working out. It doesn't mean that you quit the gym. Probably not, you know, one of the biggest reasons people quit the gym is shoulder injuries. The number one reason people quit the gym is because of injury, but the number one, I would bet shoulder injury is up there pretty high, especially with the amount of people I've heard in my own gyms complaining about shoulder pain that I go to. So just pay attention to those factors if you're starting to notice yourself experience some shoulder pain.